It's the third leading cause of death in America, and nearly 750,000 people will suffer from one this year. That's why May is National Stroke Month, a month dedicated to raising the public's knowledge of how a stroke affects the brain. Dr. David James has more in this week's Health Watch.
A stroke is a sudden interruption in the blood supply to the brain. This can happen in several ways.
One way is where a blood clot goes into the artery that gives blood supply to the brain and stops blood flow. The other is where a blood vessel may rupture and stop blood flow beyond that part to the brain.
The signs of a stroke depend on many factors, such as the side of the brain that's affected, the part of the brain, and how severely it's injured.
One of the classic signs is weakness or numbness and tingling, and even though we all get weak from time to time, it's one side of the body usually.
Additional signs of a stroke could include facial droop, slurred speech, and general confusion.
When you have stroke-like symptoms, it's just as much an emergency as a heart attack. In fact, some centers call it a brain attack. So if you develop any of those signs and symptoms, you need to call 911. Don't wait for family members to arrive or if other family members to arrive and see what they think. If you're having signs and symptoms of a stroke, it is a medical emergency and you need to call 911.
Stroke may have a wide range of symptoms depending on the severity. Those symptoms can be mild with complete resolution in time, or they may be severe and lead to permanent disabilities. If you believe you or someone else is suffering from a stroke, it is important to get to the hospital immediately. For this week's Health Watch, I'm Dr. David James.